Hey guys, you're probably here because you want to know all about those horrible, congested, blocked noses and how to unclog, unblock those horrible, congested, blocked noses. Well, I'm going to answer that question in this week's Responding to Your Comments, where we look at fun questions, we look at science-based questions, but most importantly, we always look at the evidence. So this week's Responding to Comments topic comes from Jazzy J. This is from the How to Stop a Runny Nose, and the comment is, I always have the worst blocked nose whenever I get a cold. Can you please do a video on this topic? Jazzy J, I'm going to do a video on this topic. Your comment got my attention. I like this comment, so I'm going to do my best to give you all the information I can, and anyone else who's watching, I really hope you find this information helpful. So let's begin. So first let's begin with a little science. So the blocked nose, the nightmare of a blocked nose, we've all had it before. Most commonly it's because of a common cold, similar to the comment from Jazzy J. And the good news is that they do resolve on their own within a couple of days, but there are various other reasons for a blocked nose as well, and this video is going to be really long if we go through all those different reasons, so I am going to leave a full list in the description below, and I advise everyone to give it a quick read. Now, another very common reason for a blocked nose is sometimes due to allergies as well, so I just want to touch upon this as well. Sometimes certain things such as allergens get into your system and it causes us to create histamines, which causes this inflammatory response to try and get them out of your system, so it causes a nasal congestion. It causes the runny nose, it causes the itching, all the symptoms that are associated with an allergy, an allergic response. Now, it's important to remember that each individual can react differently to different allergens. This is normal, this is what makes us human. So if you want more information on these allergens, I'm going to leave more information in the description below. But also, if you're someone who suffers from things like hay fever, for example, I have made a video about this in the past, which you might find helpful. So feel free to check that out at the end of this video. I will leave a link to it up there and in the description below. Now, let's get on to how to fix that congested nose. Let's fix that blocked nose and help you start breathing again. But first thing I'm going to say is, before we go through any tips or treatments, it's super important that you do speak to your healthcare professional first to find out what is the cause of this blocked nose. That's the most important thing. And once you've checked out with them and everything's fine, it might just be a common cold, then let's start these treatments. Now let's begin. Okay, so let's begin with tip number one. A really easy way to keep the moisture in the nose and to help with that congestion, to help with that blocked nose, is by using a saline spray or just a saline rinse that you make at home. It's really easy to make. You can pick up a saline spray from any chemist, but if you don't have, the time to go and pick one up, or it's a bit difficult for you to do that, you can make a saline rinse at home. Super easy. All you do is you get a teaspoon of salt, a teaspoon of bicarbonate soda, and you put it in a pint of boiling water. You mix it in, and then you let that boiling water cool. This is really important. Do not do anything with it until it cools to around body temperature. Okay, so now that you've made your saline solution and the temperature has come down to around body temperature and we're no longer worried about burning ourselves, you're gonna go to your bathroom. You're gonna stand in front of your sink, because this stage is quite messy. So what you're gonna do is you're gonna get the palm of your hand, you're gonna get your saline solution, you're gonna pour a bit into the palm, and then you're gonna sniff it up one nostril at a time. Do it slowly, because it can be a bit of a weird sensation to begin with. You're gonna do it in each nostril until the nostril feels comfortable and that congestion has eased and it's a bit unblocked, and then you can stop doing it. Now, when you do this, when you're doing the saline rinse, you might get some that goes into the back of your throat. You might taste it in your mouth. This is completely normal. You don't need to be worried about it. Try and spit it out. Don't swallow it. Just spit it out. It's completely normal. You're over the sink. That's the most important thing, because it is quite messy. It does take a bit of trial and error until you get used to it, but I promise you, once you're used to it, it's really easy and fast to do. Okay, so moving on to tip number two. Again, I'm trying to keep these first few tips things that you can do at home, things that we all have access to make your life easier. So tip number two is all about steam inhalation. This can actually be really helpful with a blocked, congested nose. All you need to do is boil the kettle, get that boiling water, pour it in a bowl, and then get yourself a towel, put it behind your head so it's covering your head and the bowl. Leave at least 30 centimeters between your face and the bowl. Leave more if you find that's more comfortable for you. And then slowly breathe in and out. Make sure your eyes are closed and just relax. This is really relaxing. Just be careful you don't fall asleep, but do it for about 10 to 15 minutes per session. Also, this is only advice for adults. This is not advice for children, so please be aware of that. So as I mentioned earlier, please be extremely careful when you're doing this. You don't want to burn or scald yourself. We're talking about steam here. We're talking about boiling water, so there's lots that can go wrong, so be very careful. Make sure you're leaving a good distance of minimum 30 centimeters between your face and the boiling water and the bowl. Leave more if that's okay to do as well. You just don't want to burn or scald yourself. And as I mentioned, keep your eyes closed, and this is not advised for children. Only adults should do this. But I guess for children, a similar concept would be if you run the shower and make the bathroom very steamy, and then the child can go in there and breathe in and out in the bathroom. I think that would be a good, safe, useful option that you can bear in mind. Now moving on to tip number 3, humidifiers. These can be really useful at making the mucus in your sinuses and in your nose a lot more liquidy and easy to flow to help with that blocked, congested nose. You can buy them online. They're relatively inexpensive now to buy, but if you are asthmatic or you have COPD or any lung condition, please do speak to your doctor or healthcare professional first, just to make sure that they're happy for you to get this. Moving on to tip number 4, a hot compress. These can be really useful at helping to unclog and unblock that congested nose and helping to open up that nasal passage. It's very simple to do. All you need to do is get a flannel or a small towel, put it in some hot water, wring it out, make sure that it's not too hot that you burn yourself, and then place it over the bridge of your nose and just relax. Leave it there until it cools, and then you can reapply again until you start to feel some relief. So I hope you're finding this information useful so far. So far I've been giving you useful home tips and remedies that everyone can do at home really. But I think the next step is to talk about medical treatments, medicines that you can actually take. So before we go on to these, it's super important that if you are thinking of trying any of these medicines, please speak to your healthcare professional first. Speak to your pharmacist, speak to your doctor, speak to your nurse, speak to any of your healthcare professionals, just to make sure that you're safe and suitable to use it. And always read the information leaflet that comes with that medicine before you're taking it, because again, just to make sure that you're safe and suitable to take it. That is the most important thing. I'm not going to keep saying this after each medicine that I talk about. I've now told you it. So I'm reassured, I'm going to trust you that you will check, okay? Now let's begin. Okay, so the first medicine I want to talk about is antihistamines. Remember earlier when we spoke about histamines and the inflammatory response that they can cause? So antihistamines can be quite useful for reducing that inflammatory response, in reducing the congestion and in reducing a runny nose as well, okay? They come as tablets, they also come as a nasal spray as well. They do work quite fast, so they usually work after about 60 minutes of taking them, and they can give 24-hour relief after taking them. So for example, an antihistamine like loratadine I find works quite well for these kinds of symptoms. It is a non-drowsy pill as well, so most patients, most people that take them don't feel drowsy, but there are the exceptions as well that will feel drowsy after taking it. But like I said as well, speak to your healthcare professional before trying any medication. And if you do want more information on these antihistamines and on allergies and on hay fever, like I said earlier at the start of the video, I have made a video on this topic before which you might find helpful. So again, I'm gonna leave it up there and in the description below, so feel free to check it out at the end. Now another treatment option are decongestants. These work really well and really quick at helping to unclog and unblock that congested nose. They usually work within 15 to 30 minutes. They come as a nasal spray, they come as tablets, so there's many different options available. So again, do speak to your pharmacist first before taking these, because there's many different interactions with this medicine and side effects potentially as well, so double check with them before taking this medicine, please. Also, please do remember not to use decongestants for a long time. So it's only usually advised to use them for 5 to 7 days, okay? Because the way that they work is they reduce that swelling of the blood vessels around the nasal area, they stop that, which helps with the congestion. But if you use it for more than 5 to 7 days, the opposite effect happens. It's called rebound congestion. That can happen where you're actually causing congestion by taking the decongestant. I hope that made sense. But overall, to summarize, just remember, do not take a decongestant for more than 5 to 7 days. Now another option would be a steroid nasal spray such as beclometasone. It works really well at helping to reduce the congestion, to help unblock the nose, but please do remember they can take up to several days for them to work. So usually it's best to start them, if you know you're going to start getting a blocked nose, to start them a few days beforehand, just so that you have the full effect sooner. Now if you do want more information on how to use a nasal spray, because actually using it is one of the most important things, using it properly is one of the most important things, because a lot of patients don't use them properly and you end up just wasting doses and it goes in the wrong area and you're going to get no real considerable effect from it. So if you are interested in learning how to use a nasal spray properly, I have made a video on it before. Loads of people have found it helpful. I'm going to leave it up here and in the description below. I would highly recommend everyone watches it. Whoever goes out and buys a nasal spray, please do watch it and learn how to use it properly, just so you can get the full effect from it and you're not wasting your money by wasting the medicine essentially. So Jazzy J and anyone else who's watching this with a blocked, congested nose right now, I really hope this information helps you. Please do remember though, if your congested, blocked nose does not relieve or stop after 10 days, you need to seek medical advice for it. This is super important, so speak to your healthcare professional if the symptoms last for more than 10 days. Also, there are a few other symptoms I want to make you aware of on when you should seek medical advice, and I'm going to leave them all in the description below, so please do read it and find out when you should seek medical advice sooner, because your health is the most important thing. So Jazzy J and anyone else who's watching this video, I really hope you find this information helpful. You now know everything there is to fixing a congested, blocked nose and how to unblock it and how to open up those nasal passages and help you breathe better. You're now a nasal congestion pro, so tell your friends, tell your family, tell your loved ones, tell everyone. So it looks like we've run out of time again in this week's responding to your comments. If I didn't get back to your comment, if I didn't get back to your question, I am really sorry. We are getting so many comments these days, it's really hard to fit everyone's in. So the best advice I can give all of you, which I say in every single episode, is keep on leaving those comments. Keep leaving a comment on this video, leave a comment on the next video, leave a comment whichever video you see, and eventually I will see it and I'll add it to the list and do a responding to comments video on it. Thank you for watching. I really hope you found this information helpful. It's been a pleasure. Always remember that you're awesome, and I will see you next week. Hey guys, thanks for watching this week's video. Make sure to click that like, follow or subscribe button now to stay up to date with new weekly videos.